Did you know strokes are the 5th leading cause of death in America and the leading cause of disability? What exactly is a stroke and how do you know if you are at risk? We're talking about that today with Dr. Ashish Arora. He is a neurohospitalist and a vascular neurologist with Cone Health. Good morning.
Good morning. How are you?
I'm doing great. Talk about what a stroke is first, because a lot of people may not understand what happens in the brain.
Absolutely. So a stroke is a condition that happens when the blood vessel that's carrying blood to the brain is clogged either by a clot or it ruptures. That way the brain cells don't get the oxygen and nutrients that they need, and hence they die. So the functions that they're supposed to perform are not then performed. If it affects the area of the brain that affects the motor function, meaning your muscle strength, you won't be able to move. If it affects the sensory areas, you won't be able to feel. And if it affects the speech areas, you won't be able to talk or comprehend or understand.
So what causes stroke?
So there are multiple risk factors. We like to categorize them in two broad categories. One is the modifiable risk factors, the risk factors that you can change, such as diabetes, high blood pressure, high cholesterol, smoking, and inactivity. All of these put you at a higher risk for strokes. There's certain other risk factors which unfortunately we cannot change, which are our age, our hereditary profile, if it's passed through bad genes kind of thing, and things such as a prior stroke, which once it has happened, it has happened. You can't control things in the past.
So when it comes to the risk factors, as you said, some you can control, some you can't, but how do you know where you stand? I mean, do you just need to take a look at yourself?
Absolutely. So the best way to approach this is to go to your doctor's appointments regularly. And most of the primary care physicians are very well equipped to screen you for all these risk factors that put you at high risk for strokes.
Like smoking?
Absolutely. You have to go to your primary care doctor, talk to them about your smoking, and be willing and able to participate in a program that will help you quit. That's one of the biggest risk factors, biggest modifiable risk factors, meaning you are in control of it or it can be changed. And
alcohol intake, a high alcohol intake. Would you parallel that with maybe, I mean, we talked earlier about the energy drinks and how they can be a problem.
So everything in moderation.
Right.
A drink of alcohol a night, especially, I mean, there's no consensus, but most of the studies would tell you that no more than one drink a night for men and a smaller drink for women, just because of the way that things are metabolized, difference between genders is okay, but anything in excess is bad. So moderation is the key there.
And as far as those energy drinks, that's just to stay away.
Stay away or don't just go drink 6 of them a day.
Right. Emily. Anyway, I have to tease her about that. If you want to know more about it, I am assuming Cone Health has just an incredible amount of information.
Yes, so we are very well equipped at Cone Health to address not just treating the strokes. We are one of the biggest comprehensive stroke centers around, but we also have all our team members very well adept at screening patients so that they are at they can reduce their risks and lead a healthier life.
Awesome, awesome. Well, if you want more information about strokes and if you're at risk, check out conehealth.com/stroke. Just a plethora of information there. And if you'd like more information about stroke support groups at Alamance, Guilford, Rockingham counties, just go to conehealth.com/classes.
Sage is sponsored by Cone Health.